Hey guys, today I need to update you on what's going on with the housing crackdown. I know a little while ago I talked to you about an executive order that was bringing back the concept of involuntary civil commitment. And today we're seeing the government start to take action on what that's going to look like. And I think it's important that you be aware, even if maybe this doesn't apply to you right now. I think it's important to be aware of what is going on here. So, the Department of Health and Human Services has announced $19 million in funding that will be aimed at homeless Americans with, quote, serious mental illness. This money is intended to, quote, align public health, housing, and justice systems in order to reduce homelessness and improve outcomes for individuals with SMI. So, of course, one of the first questions that comes out about this is what defines a serious mental illness, right? What kind of initiatives are going to be funded with this money? Because I tell you, I dug a little deeper and it looks like it's really only one category. Where is this money going to go? So on and so forth. There's a lot of questions that we need to answer about this. And I've done my best to get those answers for you. And we'll be going over those in just one moment here. First, I just want to remind you to call our sponsor chapter right away if you are Medicare eligible. There are over 20,000 different plans out there. It's pretty much incomprehensible for any typical person to be able to sort through what plan is actually going to be best for you in any given circumstance. But chapter that's what they do. That's their jam. They have huge databases. They can help you make sure you're on the best possible plan. It only takes about 20 minutes, and you might be able to connect with a plan that offers better mental health services, which, as you're going to see in this video, is a very big deal. So definitely go check them out. Go give them a call if you are Medicare eligible. Now, with that in mind, let's dive into what's going on here today. This story begins about a month ago with the July 28th executive order that was called Ending Crime and Disorder in America's Streets. And this executive order basically said that homelessness makes all of our cities unsafe due to drug use, mental illness, things like that. And there was this quote in there that said, shifting homeless individuals into long-term institutional settings for humane treatment through the appropriate use of civil commitment will restore public order. Now, this entire order was designed to restore the policy of encouraging civil commitment for people with mental illnesses who pose risks to themselves or the public, or who are living on the streets and cannot care for themselves in the appropriate facilities for the appropriate periods of time. So now, about a month later, we're seeing a follow-up. The Department of Health and Human Services announced that this money was being handed over to the Substance Abuse and Mental Health Services Administration. They're going to be giving out this $19 million through new funding as part of the Community Mental Health Services Block Grant. Now, like we said, this is targeting people with serious mental illness, and we're going to be talking about exactly what the definition of that is here in just a minute. But the SAMHSA organization is going to be distributing this to states in individual awards ranging from $20,000 to $2.3 million, depending on the scope of the project that they're funding. So, let's start by breaking down what serious mental illness means. Because as part of that block grant that they're using to issue this money, there is a definition there that I was able to find. And they said that adults with serious mental illnesses are people age 18 and older who have a diagnosable behavioral, mental, or emotional condition as defined by the Psychiatric Association's DSM. Their condition must substantially interfere with or limit one or more major life activities, such as basic daily living, which could include eating or dressing, instrumental activities of daily living, which would include things like taking your medications or getting around in the community, or participating in a family, school, or workplace. So if your behavioral, mental, or emotional condition interferes with or limits your ability to work, that is going to be something that they would consider a serious mental illness. There are obviously some pretty profound implications for what that means for a lot of people who follow this channel. Now, if you're freaking out right now, that was not my goal. If this definition seems overly broad and you're worried about it, please remember that right now that press release specifies that they're focusing on homeless people with serious mental illnesses, not just anyone with serious mental illnesses. So that is what is happening right now. Now, elsewhere in this press release, they also said that they are focusing on people with a history of non-adherence to voluntary outpatient treatment. So people who were voluntarily getting treatment and then didn't do what they were supposed to do to keep up with that treatment, and or this disorder that I probably can't pronounce that prevents people from being aware of their own mental illness. And the way that they are going to target that is through the use of what they call Assisted Outpatient Treatment, or AOT programs. And I did a little bit of digging to figure out what AOT programs are. AOT is a form of court-ordered treatment. It is the practice of providing community-based mental health treatment under civil court commitment. So there we are back at the involuntary civil commitment again. And if you missed our previous video, Cornell Law School defines civil commitment as the legal process by which individuals are admitted into a treatment facility or supervised outpatient treatment against their wishes. So this is treatment that people don't want that they could be compulsorily ordered into. So the way this works is they identify people who appear to be non-compliant with the treatment that they were recommended. And then they gather evidence, they go to the court, they petition for an AOT. In some states, anyone can begin that petition or investigation, it sounds like. And then the courts and the treatment teams work together to order and monitor treatment. It says that they employ specific protocols to respond in the event that an AOT participant falters in maintaining treatment engagement. So it sounds like there are consequences if you don't go along with this. I did some light research into this, and it looks like that could be, legally ordering treatment, forcing you to do things, that sort of stuff. And then at the end of each civil commitment period, they determine whether you should stay committed or be transitioned into voluntary care. And they're supposed to make sure that if you're put in voluntary care, that you continue doing it. So that is how AOT works. Now, what this means, obviously, is that states are now being pushed to align housing authorities, mental health services, and court systems. It means that more housing programs are likely to become available, but they're going to have oversight and treatment conditions attached to them. And of course, that goal is to reduce homelessness and increase public safety. And I can definitely see some cases where this is going to be useful and good. I'm just concerned because I get concerned about anything that is involuntary and that curtails personal freedom. So that is definitely a concern. Now, along with this, and to probably nobody's surprise, there is going to be data sharing requirements that go along with this. Part of the press release says that additional priorities include improving data sharing infrastructure, including the use of health information exchanges and artificial intelligence tools, and developing state level stuff. So states are going to be asked to improve data sharing, and they are going to be using AI tools, which will probably be used to help track treatment compliance, case management, and things of that nature. So we are seeing more and more push toward centralized databases and AI integration in almost every update I feel like I'm seeing lately. So obviously there's benefits and risks to this, right? So there's going to be more money for housing and treatment, which is great. There's going to be stronger coordination across agencies, which is usually a good thing. However, there is that risk of less freedom for people who don't want treatment. There's that risk of loss to housing access, increased surveillance, and possible criminalization if people resist compliance with these things as well, which is a concern. Now, as far as what you can do right now, I like coming at you with some sort of action steps. I don't ever want you to feel like you've just been run over by these updates, and I don't like it when I feel powerless or when anyone else does either. So right now, stay tuned. We know that more updates are going to be coming as HUD and DOJ carry out their parts of the plan. This is the first step in a pretty big move that was ordered in that executive order. If anyone struggles with mental health, please reach out for help early. Do not wait. Do not delay that, especially if you or someone is both homeless and struggling with a mental illness, because that is the group that's going to be affected by this. So make sure that if that is you, that you're pursuing resources and that you comply with any recommended treatment if that's a possibility for you. And then, of course, if you find yourself in crisis, 988 is a great resource line. You can also visit findtreatment.gov to see any available resources that may be available to you if you have either a substance use disorder or a mental health disorder. That's what that website is there for. And once again, if you have Medicare, it may cover more than you think. So go ahead and give a call to Chapter to see if you can find a plan that may be able to help cover additional services for you if that's an option. I wish this update had been more optimistic. I'd love to hear your thoughts on this and how you feel about it in the comments below. I like having those discussions with you guys. I will be back soon with more ways that you can save money and get free stuff.